In England, around 1 in 6 households lives in social housing. Yet many housing developments go ahead with only limited consideration of the implications for the communities that will live in them, and therefore fail to deliver the support those households need.
My name's Jenny Doyle and I completed my PhD at the University of Manchester. The focus of my research is measuring, monitoring and evaluating social impact. The idea is to make social housing developments better in the future.
I now work at Trafford Housing Trust in Manchester, using the findings from my PhD to improve living standards for the local community.
As austerity continues, service cutbacks mean that safety nets are being eroded and many individuals and communities are struggling.
Social housing is in a unique position within those struggling communities to deliver support. In my research, I found that people need more than houses. They need things like debt management advice, proactive skills training, safe centres for women, and places for children to meet and socialise with neighbours. But these things need to be implemented at the design stage of a housing development, rather than as an afterthought. My work at Trafford Housing Trust then focuses on ensuring that social impact is considered at the outset of all of our work, as well as measuring the social impact afterwards.
One of the ways in which Jenny's research has really helped us is actually related to this building here. We're at Fiona Gardens, one of our flagship extra care schemes, and we've just introduced our own in-house domiciliary care service for residents here. What Jenny's working on is giving us a greater understanding about the impact on residents' lives that our own in-house team of domiciliary care staff is bringing to residents here, compared with the experience of residents in other schemes that we have, and also the experience that residents here had of other care providers.
This combination gives us the necessary evidence to help create more sustainable impacts for our tenants.
But this is a new challenge in the social housing sector, and first we need to change our ways of working.
This means making sure that we collect good quality evidence of impact and that we understand how to analyse it properly so that we can learn how to improve. We will also have to work better with local partners to combine efforts and to make the best use of information to develop services.
We lived in the same house for 60 years and we were very comfortable until, unfortunately, Fred got gangrene and lost first one leg and then the other leg. And then he was completely wheelchair bound and a prisoner in his own home.
Wasn't wheelchair friendly at all.
Because he couldn't, he could just about get through the door into the hall.
I can get out and about now, and if Sarah's not looking, I get on the corridor and I turn this up to full shut and go down the corridor. Wind in my hair, you know, it's lovely.
One of the big challenges in social housing is making decisions about how to invest and how we can deliver the greatest social impact.
So yes, each floor is a different colour, and that's to help people with memory problems. And here we have our sensory room.
For example, community development work such as community fun days might feel like the right thing to do, but research suggests that greater and more sustainable benefits might come from other initiatives, like health programmes.
We are very, very happy here and very comfortable.
Next, I'm really keen to investigate how things change for people and communities over time. This would help us to understand how sustainable impacts are over a longer time span and which programmes we can put in place to support communities in the long term.